Hi, I'm Dr. Sam Lamb, hair transplant surgeon in Plano, Texas. I really want to start out with one topic that makes us different, which is passion. I always say when you look at your physician's eyes, your surgeon's eyes, look at what is coming back to you, which is passion. Recently, I had a large hair transplant outfit try to buy my practice because they said, Dr. Lamb, you're not really interested in hair, are you? And I said, absolutely. I love what I do every day. It's absolutely fun to come to work. I enjoy what I do. It's a creative exercise. As an artist, I have a great passion in designing the recipient sites, making sure everything technically looks good, and my team feels the same passion. So I always say that before I can talk about any other technical aspects of the procedure, it begins and ends with awesome passion. The next thing I want to talk about is really patient safety and comfort. 99% of places that perform hair transplant, they do it in an office, in an unaccredited office. Ours is a Joint Commission accredited facility, and that means a lot to you. What that means is a couple things. Number one is safety. We have everything that is there for your safety during the procedure, but also to me as important is comfort. A lot of my patients that have been elsewhere that have had hair transplant procedures come back and tell me after they've had my procedure how much discomfort they had during the procedure, that it was really, really miserable. And if you're uncomfortable, it leads to several problems. One, it makes the surgery much more difficult. And the other problem with it is that it feels as if the whole day is so long. I always say it's like flying to London in an economy class versus flying to a state a couple hours away. So it's a much shorter feeling. The other component is that hair restoration is not a procedure that's done once in a lifetime. It can be done several times, and if you have a really traumatic experience with your hair experience, you're going to remember that, and that leaves a scar on your mind, a post-traumatic stress disorder. So we are one of the few places in the nation that has a fully accredited facility to perform a procedure, allowing us to give you what's called conscious sedation and making the experience incredibly pleasant, eliminates that anxiety, and makes the day feel much shorter. So that is one of the key elements that differentiates us from other places. I liken what I do to an F1 Formula team, because if you've got a great driver in the seat and you've got a really bad pit crew, you're not going to win a Grand Prix. You're not going to win the F1 race. I value so much my team, from the person that you're going to be talking to on the phone, coming through, experiencing what you're going to have with us. We're really a family. I really believe that. It's not just a word. You're going to experience it. A lot of my patients, when they're done with the day, they say, not only Dr. Lamb, actually they don't even give me a compliment. At the end of the day, they say, man, you have great staff. Your staff is first class. And I hope they give me a compliment by the end of the day, but usually they're just so enamored with the quality and the dedication of my staff that is what rings true to them. So I don't have an A team, a B team, a C team. I don't have random people assisting me. I have the same team performing the procedure every time. And so a lot of people say, you know, how many procedures do you do? There is this perfect mix of doing too many and too few. If you're doing 10 a week, there's no way the surgeon can deliver quality. There's no way the team can deliver quality. You're gonna have random teams showing up and helping you out, and that's not good. I want to have the best team and me as a surgeon working with you. So that's very important. If you only do 1 or 2 cases a month, well, you're not gonna get the experience level. You're not gonna deliver that. I've been in practice almost 20 years, and that to me is so important as having a dedicated team working with a dedicated surgeon for awesome outcomes. We perform the full gamut of hair restoration as well. We perform different ethnicities, from Asian, African, Middle Eastern, Hispanic, Caucasian, female, male, eyebrows, corrective procedures, FUE, FUT, strip procedures, everything. Corrective, plug corrections, scar corrections. And you say, well, you know, how do you perform all that? Why is that so important? The reason is that, let's take some examples, okay? If you're working with African American hair, it's so different. Eyebrows in African American, which we do a lot of, is so difficult to perform well. And it is the highest level of art. And I believe if you can do something as delicate and so detailed and artistic and technically perfect as that, you can get excellent results. Another question is that you know, why perform a linear incision? That seems so outdated because of all the marketing out there. You must perform FUE. And I've written the only textbook on FUE. I'm actually in the process of writing a double volume, so it would be double the size of the only book ever written in the world. So we perform quite a few FUEs, several a week. But the strip procedure is not outdated. It preserves total donor capacity. For women, to me, it allows you to get the best harvest zone, allows me to stay away from unsafe areas, but not everyone's a candidate for this. The trick, though, is to be able to offer patients all techniques. If you can only offer one technique, everyone has got to do this. And so for me, being able to do corrective work, difficult work, easy work, if you will, but there's no such thing as that. Females, males, different ethnicities, you can truly create, in my opinion, the most artistic results out there, and being able to exercise that level of creativity offers my patients something that I think people can't do if they're just doing one type of hair transplant for everyone. A lot of people ask me, how would you describe what you do, Dr. Lamb? And I like to say it's a boutique outfit. What does that mean? It's not talking about clothing, which is actually a passion of mine, but it's about the atmosphere where we're really, really focused on your care. We're not here to offer you something where I'm not a part of the procedure. A lot of places are just chains. In fact, I would contrast boutique versus chain. Chains are places where you may never meet the physician, you may just talk to a tech, the tech may be doing the procedure. The place is a cold atmosphere, they're trying to sell you. You're gonna feel a very hard sell to make sure you close today. If you don't close today, they'll give you a discount, they'll give you this. I am not focused on sales, although I am in the sense that I'm very, very passionate what I do, and I believe that we can do it better for you. So being a boutique means we do one procedure a day. We're dedicated to safety, we're dedicated to artistry, we're dedicated to technical performance. We are focused on awesome care where you feel from the beginning to the end that you've got the best result that you can from us. Not just that you're a number, not just that you're going through and you're just part of a formulaic process to hair restoration. I am very focused on a very customized solution for you, and this is not just some contrivance or words I'm expressing, but really, really focused on your results. I have a lot of passions. One of my passions, besides just the passion of hair restoration, is a topic called regenerative medicine. It's simply been overlooked, and what this means is the fertilizers, the things that I add to a hair transplant for excellent results. I personally believe if you got the best surgeon and the best team together, you still may not get the best results. A colleague of mine out of Brazil wrote a concept called the personal growth index. What he says, he does long hair transplants where he measures the hair mass index at the time of the procedure and then 8 to 12 months later, and he can actually quantify what percentage grows. He found that if you go to the same surgeon, same team, and you do a procedure, you will have the same percentage growth in every single case, almost. And since 2011, I've been using platelet-rich plasma, or PRP, with surgery, as well as A-cell porcine bladder matrix together as fertilizers. And I've found that this personal growth index, where if you come to me and I add these elements, I get a much better growth result, much higher percentage of consistent graft growth results. And then in 2014, I added hypothermosol and ATP, another 2 levels that have just gotten so much finer growth, faster growth, more consistent growth. So the summary is that even if you go to the best surgeon and the best team, if you have your own anatomy, which the hair surgeons call the X factor, which means that your anatomy restricts the ability to get good graft survival, I have found since 2011 that adding these fertilizers helps me get much more consistent graft survival. And that is a topic that is so important. It goes well beyond what the surgeon and team can offer. And to me, it's a vital component to your success. I opened this video talking about passion, which really it is the core of what I do. I absolutely love what I do. And part of that passion is for leadership. Leadership means creating a culture of care, a culture of accountability, a culture of responsibility, a culture of performance, and accepting nothing less than that. My partner in this practice for now close to 20 years, Amina Vance, also is a leader, and we're both leaders. And then beyond that leadership structure, we all have leaders in our practice. What does leadership mean? Well, I've just defined some elements to it, but I am president of the American Board of Hair Restoration Surgery in 2021. I have taken multiple leadership roles in the International Society of Hair Restoration Surgery. Leadership for me means going to all the meetings, being actively involved. I'm currently writing a chapter on FUE anesthesia, and guess what? As much as I've written and that I'm educating the next generation, I'm also learning. I have run a hair meeting that has been well received for beginner surgeons for well over a decade now. And the reason why that meeting is so well received is because all the educators are passionate. But leadership means staying at the forefront of what's going on. If your doctor is not going to meetings, if your doctor is not actively engaged in the leadership capacity in the societies, if your doctor is not actively trying to get better at what he's doing, I always like to say, if you're green, you're growing, if you're right, you're rotting. And if you don't have great leadership, you don't have a great practice. And leadership always starts at the top. You cannot hold everyone accountable below you if you're not performing at the highest level. So leadership to me is a vital component to what we do and who we are in our industry. I talked a lot about different topics in hair restoration. When you come to us, the key things is you're not going to get a sales pitch to make sure you sign up. The second thing I'll tell you is that we're here to educate you. I'm here to really focus on telling you what you can and cannot do. I'll tell you that I turn the majority of my patients away from surgery. I hate to tell you that, but there is, on a given day, I only accept about 20% for surgery. In these high pressure clinics that are boutique, they're not boutique, they're just chains. I don't know, but I would surmise that they're probably an 80-90% closing rate. I don't care about my closing rate. I want you to make sure that you're safe. So I talk about safety of whether you're a good candidate, whether you're not a good candidate, what are the long-term consequences. I had a gentleman that came to me, he was 27 years old, he wanted a hairline like this, and I told him, you can't do it. He goes, well, I don't care what I would look like at 40. Because we can't conceptualize what we want 10 years from now, 12 years from now. But it's my ethical responsibility to care what you're going to look like in 10 to 15 years. Of course, none of us have a crystal ball. But from experience and from an ethical responsibility to what that person should look like in 5, 10, 15, 20 years, I have to give you counsel. So I may not even offer you surgery. And the vast majority of places that are these chain outfits that are trying to sell you a procedure rather than educate you about your options, their number one goal is to sell you that procedure. So my number one goal is education and giving you options. So I hope you come to see us in Plano, Texas, which is north of Dallas, Texas. I hope you can sense that what we want to deliver is a higher quality result for you and a higher quality experience.